How's it guys, and welcome back to my channel. My name is James, and today we're going to be doing heart rate and blood pressure explained. So this seems to be a topic that people are wanting to learn about, and exactly what we're going to be talking about is how does you as a layperson, someone who's not medically qualified, look at a blood pressure or look at a heart rate and understand or have a better understanding of what either you're going through or a loved one or someone else who you know is going through, so that if you see this, you'll have a better idea. And at the end, I'll give you this little trick that if you know this, then you'll know that and you're going to be able to do this. And it might just really help you out in the future, so stay tuned to that. So first, let's just cover blood pressure and what exactly it is. Blood pressure is the pressure inside your arteries. The pipes that are coming out of your heart that are high pressured, they're carrying your blood all over your body to wherever it needs to go. Your veins are the ones that carry the blood back to the heart. So this is the pressure in your artery, and so it is made out of two numbers. The top number is a systolic number, and the bottom number is a diastolic. Basic words or terminology to explain that is that the systolic number is actually just the pressure during a heart contraction. So while the heart is beating, how much pressure does the heart put out? Or I guess need to put out. Diastolic is the amount of pressure when the heart is at rest. So the heart is resting, this is how much pressure there is in your arteries, and that is the blood that is then getting to all of your kidneys and lungs and your brains, just your whole body. What's important is that if your numbers go too low or too high, you will have problems, and we're going to get into that now. So your systolic number, which is the one at the top, really shouldn't go below 90. That's when you're going to start to have problems, and it shouldn't really go above 130, 140, really depending on how old you are. As you get older, your blood pressure tends to go higher. It's important to keep this under control, because obviously if your blood pressure is too high, it means there's too much pressure in your arteries, and therefore your heart has to work even extra hard to get blood into your arteries to get the blood to where it needs to go. The diastolic value is when the heart is at rest, and it should not go below 40, 50, somewhere around there. And this is when blood is just passively moving or passively being pushed into your vital organs to give you the oxygen and the minerals that they need. Other issues that happen with blood pressures is that sometimes the numbers get very close. So let's say you have a blood pressure of 100 over 90. It means there's only a 10 difference in your blood pressure, which is not very good. You're going to have severe problems. This can happen in like blood loss, or if you have sometimes even if you have a chest infection, you can have a narrowing pulse pressure, which is when your systolic and diastolic move closer. You also can get a widening pulse pressure, so you could have a blood pressure of 140 over 50 or 140 over 40. That's quite a wide blood pressure, and that is also an indicator of other problems. There's a range of things, it's just something to be mindful of. So that pretty much sums up what a blood pressure is. I hope I covered everything there. If I didn't, please drop a question below. Then it comes to a heart rate. So heart rate is pretty self-explanatory. It is how fast your heart beats in a minute. Same as the blood pressure. If it's too high or too low, you're going to have problems. Normal for an adult, as I would say, between 60 and 100. If you go any lower than 60, you're going to have problems. If you go any higher than 100 and you're not exercising, you're probably going to have problems too. What is important with a heart rate is that when you get below like 50, you may have problems. It's only a problem if you feel unwell. That's kind of what medical personnel will also do, is that if you have a very slow heart rate but you feel absolutely fine, probably something going on, but you're okay. If your heart rate is very high and you feel absolutely fine, there's probably something going on, but you're okay. It's when your heart rate is high or very low and they're not feeling very well is when we have a much bigger problem. And so when it comes to a slow heart rate below 50 would be considered like significant. If it's like 55 or 52, it's not really that slow. Less than 50 is considered significant, and a heart rate of above, I think it's like 140 or 150, we would also consider that as significant, especially if they're just at rest. Someone's been running a marathon or cycling or like some sort of extreme sport, we can understand a heart rate being much higher for obvious reasons. And then it comes to that little tip and trick that I was telling you earlier. It's a rule of thumb that I use, and it's also one I've read in textbooks and in some journals that I've looked at, is that if you have a heart rate of above 100 at rest and you have some sort of medical condition, you are considered unwell and that you should probably seek medical care. So what that means is that if you have like a chest infection or you have something wrong with you, I don't know what kind of like whatever medical condition it could be, and you're sitting at rest and your heart rate is above 100, you are considered unwell, and that I would recommend you seek help, and that is something that is then significant is going on in your body for you to have a heart rate that high while you're not like exercising or running or walking or whatever the case is. A quick little lesson on how to take a heart rate, I guess that would be useful too, is that if you just take your hand or your arm and you put your fingers on top of your bone on your thumb and you just roll your fingers down below, you will feel your pulse. And you can then count for 30 seconds and times that by 2, because that gives you then a minute of a pulse. Or you can count for 60 seconds if you wish, and that's your pulse, or count for 10 seconds and times it by 6, or count for 15 seconds and times it by 4, whatever you want. So guys, I hope this was helpful. I hope you learned something. If you have any questions or comments, please drop them below. And please, if you did enjoy this, subscribe. It really helps me out. And appreciate your time and have a good day. Bye for now.